Hey guys, welcome to my channel Dentistry with Kashaf. Okay, let's talk about the muscles of the facial expression. There are total 20 muscles of facial expression on each side of your face, and they are derived from your second pharyngeal arch and innervated by the facial nerve. Those muscles are responsible for your facial expression, speech, articulation, eye protection, eating, smiling, crying, blinking, whistling, and even your emotional communication, like communication through your facial expressions. And the first muscle is called as occipitofrontalis muscle. The name indicates its origin and insertion. You see here is the origin is from your occipital bone and inserted into your skin of the eyebrows. And action is to raise the eyebrows, wrinkles of the forehead, expression of the surprises, and it is innervated by your temporal branch of the facial nerve. Okay. The second most important muscle is your orbicularis oculi. See, this one is your orbicularis oculi muscle, this round and big one. Okay. We see here it has three parts: orbital part, palpebral part, lacrimal part, and action is to close the eyelids, blinking, winking, protects cornea, and clinical important is the paralysis, which will cause inability to close the eye and on other terms will cause your corneal ulceration. Yes, in fact, your eyes is not closing, then your cornea will be damaged by your external environment. So this muscle is called as corrugator supercilii, and this is the obvious. Action is to draw the eyebrows downward and medially, and that produces a vertical forehead wrinkles and expression of angers and concentration is done by this. Okay. The next muscle is called as procerus muscle, and you see it very obvious connecting your forehead with your nasal bridge. So, its action are to produce wrinkles over the bridge of the nose and creates the transverse wrinkles also. And expression of disgust is done by this. And this obvious muscle is called as nasalis muscle. The obvious actions of these muscles include like it compresses the nostril, dilates the nostrils, and it is important during deep inspiration. The next is called as depressor septi nasi or depressor septi nasi. Okay, its action is to pull the nasal septum downward, as its name indicates, depressor septi nasi. Okay, this muscle is called as orbicularis oris. The previous one was orbicularis oculi. Okay, it is known as the kissing muscle. In action is to close the mouth, purses the lips, whistling, kissing, and speech. A lot of function it is performing. This is called as your buccinator muscle, and you know what does buccinator muscle do? Help in chewing. And it is also called as trumpeter's muscle. It compresses the cheek, prevent food accumulation between teeth and cheek, blowing, whistling, and clinical importance is that its weakness can lead to the food collection in your vestibule area during the chewing process. This muscle is called as zygomatico major, and the second one is called as zygomatico minor. So you must know the difference. So there's a difference in their action. Major elevates the angle of mouth and help in the expression of smile, but the minor one actually elevates your upper lip. Okay, this muscle is called as levator labii superioris. Its action is to elevate your upper lip and expression of sadness and disdain. And this one is depressor labii inferioris. As the name indicates, it pulls your lip downward. Okay. This is called as levator anguli oris, and the second was is called as depressor anguli oris, as the name indicates their function. The first one elevates the angle of the mouth, and the second one depresses the angle of mouth, and expression is sadness. Okay. The next muscle is called as risorius muscle, as the name indicates. Its action is to retract the corner of mouth, and expression of grinning is done by it. Okay, this is your mentalis muscle, and we know what does mentalis muscle do. It protrude your lower lip, wrinkle the chin, and expression of pouting is done by it. Last but not the least is your neck muscle called as platysma. And you know what does it these muscles do? Origin is your upper chest and shoulder fascia, and insertion into lower mandible, lower face. Action is to tense neck, skin depresses mandible, pulls your lower lip downward, and expression of fear and tension is created by this muscle. Okay, let's summarize these expressions in one whole slide. Okay, first one is smile, done by zygomatic major and minor. Sadness by depressor anguli oris and labia inferioris, depressor ones. And surprise is done by your forehead, of course. So frontalis and orbicularis oculi muscle. Anger by your corrugator superciliar process. Fear by platysma and frontalis. And disgust by levator, labia superioris and nasalis. Sorry, the disgust was from your procerus muscle too, okay? Pouting by your mentalis and whistling through your orbicularis oris and vaccinator muscle. Everything. Nerve supply is from your facial nerve, and we know that it exits the skull through the stylomastoid foramen and enters the parotid gland. It is divided into 5 terminal branch. The first one is your temporal, second one is zygomatic, third buccal, fourth marginal mandibular branch, and the fifth one is cervical. And there is a mnemonic to Zanzibar by motor car. If you are not remembering that, it's totally fine. Okay. The blood supply of this muscle we have already discussed in our previous videos. If you watch that, you will be more obvious. But I have mentioned it here very clear that facial artery, superficial temporal artery, infraorbital artery, transverse facial artery, ophthalmic artery branches, and venous drainage is occur through mainly through your facial vein. Okay, this was the nerve and blood supply of your muscles of facial expression. Now we will discuss some of the clinical correlations related to your muscles of facial expression. The most important, the first one is your upper motor neuron lesion and lower motor neuron lesion. You cannot remember the whole description, but remember one trick. If the upper motor neuron lesion is involved, means the lower face is involved, affected. Or if your lower motor neuron lesion is involved, then it means your upper and lower face both are involved. You can see clearly the difference. In the first picture is upper is spared. In the second is lower motor neuron, so the upper is not spared. How you will know? The eye is drooping down, it's closed, and the forehead is not producing any wrinkles in the second picture, which can clearly differentiate these two. Further, you have to remember the causes, what actually caused the upper motor neuron lesion, lower motor neuron lesion. So it is a basic clear difference written on the screen. But we will discuss its description in a separate video. Like Bell's palsy is basically your lower motor neuron lesion. It is caused by inflammation or compression of facial nerve and features in entire affected side of the faces, both upper and lower. Inability to close the eye, dropping of the angle of the mouth, loss of the forehead wrinkles, and difficulty in smiling, blowing, and whistling is done by these muscles. Okay. The second one is your upper motor neuron lesion, and obviously we discussed these both early. It is also called as central facial palsy, and it features are weakness mainly of the lower face on the opposite side, and forehead muscle are usually spared because of received bilateral cortical input. This is the reason it is spared. Okay, the second most important is your parotid gland surgery, because as we know the anatomy of the facial nerve, it passes through your parotid gland. If any of the procedure is performed, like some of the parotidectomy or some tumor compressing it or accidental damage or anything that will lead to any of related symptoms. Possible outcomes could be your facial asymmetry, difficulty in smiling, inability to close the eye, and drooping of mouth. Okay. The third one is your synkinesis. Synkinesis, I would easily say, if your facial nerve is damaged and it is regenerated into the abnormal position and you are contracting one muscle but the other one is also involuntarily controlled, like it is just like the two muscles are working in coordination, like misdirected regeneration of facial nerve occur. So I will mention some of The example, like for example, if you close your eyes, the patient will smile. For example, if a person is smiling and suddenly his eyes are closed. And there are some other plenty of examples need to be checked by your physician. Okay. The next one is your Botox, and everybody know the Botox nowadays because it is the trending cosmetic procedure everybody performing. Like you are making your facial muscles abnormal to look beautiful, to look young, or maybe some of other facial nerve compression or spasm you are treating. For what reason you are using Botox, but you are actually blocking the nerve signals for the muscle, so the wrinkling and everything would not be produced. These are used for your cosmetic procedure, hemifacial spasm, blepharospasm, migraine treatments. It contains toxin called botulinum toxin, which block the acetylcholine release. Okay, this is called as hemifacial spasm. This is done by your facial nerve compression in your brain stem, and some of the symptoms will produce, like you see the eye, the mouth, one side of the face is affected, and the differentiating feature is that it lasts from seconds to minutes, so you can differentiate it from your Bell's palsy. Okay. Uh, we say the involuntary contraction of the muscle on one side of the face, usually due to facial nerve irritation. Very simple. Last but not the least is your Mobius syndrome. Here you see this is the congenital disease. So there is nothing to do with your any trauma or any surgery or any nerve compression. This is a congenital condition where there is a expression like face, no blinking of eyes, both sides of the facial paralysis can be present, and your limbs and feet, everything is involved. Expressionless face you can see in this condition. Small mouth like micrognathia like condition will be present. So it clearly says resulting in expressionless face and inability to smile. Thank you so much for watching, guys, and don't forget to subscribe to my YouTube channel and share with your friends.